Measuring fundal height is the balance from the pubic bone to the top of the uterus, measuring in the centimeters after 20 weeks of pregnancy. The fundal height measurement often matches the number of weeks of pregnancy. Its purpose is to assess the fetal growth and development during the pregnancy. You'll only use a tape measure in this procedure. Leopold's maneuver are four basic steps in palpating the uterus through the abdomen in order to determine the presentation of the fetus. Its purpose is to determine fetal presentation and position by systematically palpating the abdomen. You'll just need a pillow or rolled towel in this procedure. The patient should empty her bladder before performing this. She must be in a comfortable position with knees flexed and also make sure that the hands are warm before coming in contact with the patient's abdomen. The fetal heart tone is usually done to confirm the location and position of the fetus by checking the rhythm and heart rate of the beat. Assalamu alaikum, ma'am. I am Rohanisa A. Fetal and I will be your student nurse for today. Ma'am, can you please state your name?
I'm Sahara.
Okay, Miss Sahara. Today I will be performing Leopold's maneuver. We'll monitor your fetal heart rate and I will also measure your fundal height. It is in order for me to evaluate your fetal presentation and fetal pulsation. Also to monitor the condition of the baby. The fundal height will be measured because it correlates the age and the stage of your baby pop. So before we start, would you like to empty your bladder first to promote comfort and also for us to have an accurate palpation? Kakaihi ko lang po. Okay, that's great. I will then position you in dorsal recumbent position. So let me assist you po, ma'am. Bend your knees, slightly flex. Also, I will position a small pillow under one side. It is to prevent a supine hypotension po. Now, before we start, let me wash again my hands with warm water to prevent spreading of microorganisms and infection. Wait for a while po, ma'am. Now that I have washed my hands already, let me pull off your shirt po, ma'am. Don't worry because I'll be only exposing your abdominal and I ensure 100% privacy because all the data that will be gathered today is safe and confidential. Now, ma'am, I'll first start measuring your fundal height. Let me get the tape measure. I will be measuring from the top of the symphysis pubis over the abdominal curve to the top of your uterine fundus. Your fundal height po, ma'am, is 24 centimeter. This measurement po, ma'am, is used to determine the age of the station of the baby through McDonald's rule. Now we have done measuring your fundal height po, let us proceed with the Leopold's maneuver. Since you have already emptied your bladder, we will now start. I have also washed my hands already, and I'll first observe your abdomen and see where is the fetal movement more apparent. So let me just observe. Okay. Now I'll start with the first maneuver, or the fundal grip. This will use to determine whether it is the head or the bridge of the baby that is located in your fundus area. I'll position my hands in a triangle position and start palpating po. Okay, I can feel soft and it moves along with the body. Therefore, it is the bridge. If ever I palpated hard and round po, therefore it is the head of the baby. Now, we will begin with the second maneuver, or the umbilical grip. It is to determine where is the back of the baby I will use both of my hands and place it on the both side of your belly. This left hand will be used to support while my right hand will be used to palpate. I'll start palpating from the top to the bottom. Now I will do it on the other side. Okay, on this side I have felt hard and resistant, therefore it is the back of the baby. While on this side, my palpations are irregular po, therefore it is the extremities of your baby po. Now we will proceed with third maneuver or the pollex grip. This will help us determine what is in your pelvis and also its mobility. Now I will position my hand in an L position in your symphysis pubis. Here I can feel hard and round, therefore it is the head of the baby in your pelvis. Now I will try to leave your symphysis pubis. If the symphysis pubis can be lifted, therefore it is not yet engaged. But if the symphysis pubis can no longer be lifted, therefore it is engaged already. I'll now try to press it using my thumb and index finger. Okay, ma'am. The symphysis pubis can no longer lifted, therefore it is engaged already. Alhamdulillah. And since it's already encephalic, we will now proceed to the fourth maneuver or the pelvic grip. This will help us determine the fetal attitude and also the degree of fetal extension into the pelvic. And this maneuver, I will now face at your feet po. I will put my hands in approximately 2 inches in the inguinal ligament. So I will place my hand here. Now, ma'am, I will slide down inward along the vertical line. Okay, ma'am, on this side, one of my fingers slide along the contour without obstruction. Therefore, it is the back of the neck of the baby po. While the other side, one of my fingers meet with obstruction. Therefore, it is the brow of the baby. It means, ma'am, that the baby is in a good condition, attitude rather. Congratulations. We are done with the Leopold's maneuver. Now I will proceed with monitoring the fetal heart tone. Let me perform hand hygiene again first. I will be monitoring the fetal heart rate tone to know the condition of the baby. Okay, I will get now the stethoscope. Ma'am Sohara, since we have already performed the Leopold's maneuver, specifically in the second one, which is also known as the umbilical grip, I now have an idea rather, where is the back of the baby. And since the back of the baby is at the side of, on your left side, therefore, I will auscultate at this side. Let me warm the stethoscope because we will use the bell of the stethoscope since we are going to auscultate for a fetal heart sound. Now we will proceed with the auscultation. I will listen for your fetal heart rate tone for 1 minute to determine whether the beats are regular or irregular. Ma'am, your fetal heart tone is 150 beats per minute po. If we are going to use a Doppler, I'll first apply a water gel on your abdomen where the baby is located. Now we are done with all the procedures po. The baby is in a good condition, alhamdulillah. So now I will record and document all the details that I have gathered and I will talk to your attending physician and will let you know when is the next schedule for your next checkup. Thank you so much, ma'am, and thank you for your cooperation. Let me just assess you.